Governor Stein also addressing health care across North Carolina today after the U.S. Senate voted to pass President Trump's budget bill. Some are worried the bill will cut things like Medicaid and SNAP benefits in an effort to cut down on fraudulent spending. On your side's Davis Supas brings us details on reaction from state officials and the governor's moves to help out North Carolinians.
Governor Josh Stein signing House Bill 67 and hosting a news conference with the North Carolina Department of Health and Human Services to be proactive about how health care benefits will be impacted across our state.
It will be a crisis. What we are seeing at the federal level would represent a devastating loss for North Carolina. More than 1 in 4 North Carolinians count on Medicaid coverage for their health care.
Senators Tom Tillis and Ted Budd also reacting to the decision.
What do I tell 663,000 people in 2 years or 3 years when President Trump breaks his promise by pushing them off of Medicaid because the funding's not there?
Senator Budd releasing a statement saying he voted in favor of the bill because North Carolinians deserve more of their wages, a secured border, and responsible spending reforms for government programs. He goes on to mention that he hopes the House gets this bill to Trump quickly to avoid Americans having to afford the largest tax increase in our nation's history. Officials with NCDHHS explaining how difficult it will be for the state to come up with the funding for these medical programs instead of receiving it from the federal government.
North Carolina, again, would be up to $700 million annually. Or 2, reduce enrollment to lower costs. And then finally, 3, the most concerning, would be forced to withdraw from the SNAP program altogether.
Other DHHS officials saying rural health care will lose $6.5 billion and that the state will only be able to cover about 1/3 of the costs compared to the current plan. Devastating, especially in rural areas.
They're not going to stop getting sick. It's just going to be way more expensive to take care of them.
Stein did sign House Bill 67, the PA Team-Based Practice Act today, allowing healthcare teams to pivot and address challenges where they are needed most. Mark Hollow with the North Carolina General Assembly saying this will allow flexibility and physicians' assistants will be better equipped to provide care to patients. Davis Supas, 9 on your side.